Florida's healthcare system isn't collapsing at the top, it's collapsing at the bottom. At free clinics across the state, something unusual is happening. Waiting lists are exploding. Appointment slots are disappearing weeks in advance. And the fastest growing group of patients isn't the uninsured, it's the insured. In Jacksonville, Tampa, and South Florida, nonprofit clinics report a sharp surge in applications from people who already have health insurance but can't afford to use it. Premiums are rising. Deductibles are swallowing entire savings accounts. And basic medical care is quietly becoming optional. This is happening before January 1st, 2026. That's the moment millions of Floridians will feel the real impact of expiring healthcare subsidies when monthly premiums reset, deductibles jump, and coverage becomes unaffordable overnight. As clinics fill up and emergency rooms brace for impact, Florida's political leadership has chosen silence. No emergency session, no warning, no plan to absorb what's coming. Because when people stop seeing doctors, they don't disappear from the system. They come back later, sicker, poorer, and far more expensive. And Florida is about to find out how fast that bill comes due. January 1st, 2026 isn't symbolic. It's mechanical. That's the date when Enhanced Affordable Care Act tax credits officially disappear, and the math inside Florida's health insurance market changes overnight. According to the Centers for Medicare and Medicaid Services, Florida currently has about 4.7 million people enrolled in ACA marketplace plans, more than any other state in the country. Roughly 9 out of 10 of those enrollees receive federal subsidies to keep premiums affordable. Without those credits, premiums don't rise gradually. They snap upward. Analysis from Florida Policy Institute and KFF shows average monthly premiums for subsidized Floridians could jump between 90 and 130%, depending on age, county, and plan type. For a typical 60-year-old enrollee in South Florida, that translates to $500 to $800 more per month just to keep the same coverage. And Florida is uniquely exposed. The state has one of the highest shares of gig workers, hospitality workers, and small business owners in the nation, jobs that rarely offer employer-sponsored insurance. At the same time, Florida is one of just 10 states that refuse to expand Medicaid, leaving hundreds of thousands stuck in the coverage gap. As a result, Florida already ranks third highest in the nation for uninsured residents, behind only Texas and Oklahoma. Now, layer on what happens next. The Florida Policy Institute estimates Florida's uninsured rate could jump from about 11% to nearly 17% in a single year. That's between 1.1 and 1.9 million additional people losing access to regular medical care. Not because they don't want insurance, but because the numbers no longer work. And this is before a single emergency room visit, before a single diagnosis, before the system absorbs the shock. When insurance disappears, people don't disappear with it. They show up somewhere else. Across Florida, free and low-cost clinics are already absorbing the early shock months before January 1st, 2026 even arrives. According to reporting from First Coast News and Florida Phoenix, clinics serving uninsured and underinsured patients are seeing double-digit surges in applications. Some report 30 to 50% increases in patient volume in less than a year. In Northeast Florida, one free clinic documented a spike driven almost entirely by people who still technically have insurance but can no longer afford deductibles, co-pays, or prescription costs. This is the underinsured problem, and it's growing faster than the uninsured one. Here's the structural issue. ACA plans in Florida increasingly come with deductibles between $7,000 and $9,000, according to KFF. For someone making $35,000 to $45,000 a year, that deductible alone represents 20% of annual income before premiums. So people do the math. They skip preventive care. They delay diagnostics. They stop filling prescriptions. That behavior doesn't save money. It pushes people into emergency rooms. The Florida Hospital Association has already warned that ER utilization by uninsured patients could rise sharply in 2026, shifting billions in uncompensated care costs back onto hospitals, counties, and insured patients through higher prices. And here's where policy choices matter. Florida leaders, including Ron DeSantis and Byron Donalds, have not called for extending federal ACA tax credits. They have not proposed a state-level backstop, and Florida still refuses Medicaid expansion. Democratic leaders like Nikki Fried warn the result is predictable: more uninsured residents, more emergency care, fewer doctors willing to practice in high-risk areas. The system doesn't break all at once. It clogs, and Florida's clinics are already telling us what happens next. This isn't just a healthcare story. It's an economic shock Florida hasn't priced in. According to the Commonwealth Fund, Florida stands to lose up to $5.5 billion in state GDP if ACA subsidies expire and coverage drops at projected levels. That loss doesn't come from hospitals alone. It comes from missed workdays, from untreated chronic illness, from families redirecting money away from housing, food, and local businesses just to survive. The same analysis projects nearly 50,000 jobs at risk statewide, not theoretical jobs, but real positions in healthcare, retail, hospitality, and small business services that depend on consumer spending. Here's why. When premiums jump 20–40% and deductibles climb past $8,000, households don't just cut healthcare, they cut everything else. Florida Policy Institute estimates that if uninsured rates rise from 11% to nearly 17% in 2026, that means between 1.1 and 1.9 million additional Floridians without coverage. That's a population larger than Miami. Hospitals don't eat those costs quietly. The Florida Hospital Association warns that rising uncompensated care forces hospitals to either reduce services or raise prices, especially in rural and lower-income counties. That cost gets passed on through higher insurance premiums for everyone, higher charges for employer-sponsored plans, higher county and state budget pressure, and none of this is offset by Medicaid expansion because Florida still refuses it. So the math stacks up fast. More uninsured patients, more emergency room dependence, more financial strain on hospitals already operating on thin margins. And all of this hits before January 1st, 2026, because families are already making defensive decisions right now, skipping enrollment, downgrading plans, or walking away entirely. This isn't a cliff. It's a slow-motion collapse, and Florida is walking into it with no safety net. This is the part politicians never mention. Florida's crisis isn't just about people losing insurance. It's about people having insurance and still being locked out of care. Across the state, free and low-cost clinics are reporting record demand. At clinics in North Florida and the Jacksonville region, administrators say new patient applications have surged 30–50% over the past year alone. Not because people are uninsured, but because their deductibles are too high to use their plans. Patients are walking in with ACA coverage and saying the same thing. I can't afford to see my doctor. Deductibles now routinely exceed $7,000 to $9,000. Out-of-pocket maximums push past $10,000. For a household earning $40,000 to $55,000 a year, that's not health insurance. That's a financial barrier. Meanwhile, Ron DeSantis has argued that Floridians under 50 should rely less on preventive care, even as medical economists warn that delayed treatment increases long-term costs by 2 to 4 times once conditions reach emergency stages. And Byron Donalds has publicly questioned whether working families need what he called comprehensive coverage at all. Here's the reality on the ground. Emergency room visits among uninsured and underinsured patients cost hospitals 3 to 5 times more than primary care visits. Those losses don't disappear. They get passed on through higher premiums, higher local taxes, and reduced services. Florida already ranks 3rd highest in the nation for uninsured residents, behind only Texas and Oklahoma. Policy analysts project that without intervention, Florida's uninsured rate could climb to nearly 17% by 2026. That's not a policy debate. That's a systemic failure. Because when preventive care becomes optional, illness becomes inevitable. And when illness becomes unaffordable, the system collapses inward clinic by clinic, ER by ER. Here's what makes Florida different from every other state in this moment. Florida is walking into a coverage collapse by choice. The state still refuses to expand Medicaid. That single decision already leaves more than 800,000 low-income adults in the so-called coverage gap, earning too much to qualify for Medicaid, but too little to afford private insurance without subsidies. Now add the expiration of enhanced ACA tax credits. According to KFF projections, Floridians in some congressional districts could see annual premium increases exceeding $6,000 per household. In South and Central Florida districts with high ACA reliance, monthly premiums could jump $400 to $600 overnight. That timing matters. Open enrollment decisions are being made before January 1st, 2026, meaning families are locking in choices right now, often without knowing whether Congress will act at all. Policy experts warn this creates a one-way exit problem. Once healthier enrollees drop coverage, risk pools deteriorate. Insurers respond by raising prices. Higher prices push more people out. That feedback loop is known as the insurance death spiral, and Florida checks every box. Meanwhile, state leadership offers no backstop, no Medicaid expansion, no state-level subsidy bridge, no emergency stabilization fund. Instead, hospitals and clinics absorb the shock. The Florida Hospital Association estimates uncompensated care costs could rise hundreds of millions of dollars annually, forcing service cuts in rural counties and safety net hospitals first. And when hospitals cut services, ER wait times grow. When ERs back up, outcomes worsen. When outcomes worsen, costs explode. This isn't ideology anymore. It's arithmetic. Every month of inaction increases the number of people who will never re-enroll, even if help comes later. By the time lawmakers act, the damage may already be baked in. January 1st, 2026 is not the day Florida's healthcare crisis begins. It's the day it becomes permanent. By then, millions of decisions will already be made. Plans dropped, coverage downgraded, treatments delayed, diagnoses avoided. People won't be waiting for Washington anymore, they'll be surviving without it. Once families exit the system, most don't come back. Not because they don't want coverage, but because re-entering later costs more than staying in financially, medically, psychologically. That's the part rarely discussed. Health insurance isn't just a line item. It determines whether a tumor is caught early, whether a chronic condition is managed, whether a family goes bankrupt after an accident. Florida already ranks among the highest uninsured states in America. By 2026, projections show that rate climbing even higher, not because people became reckless, but because the math stopped working. And while politicians argue over ideology, clinics are filling up. Hospitals are bracing for unpaid care. Families are quietly calculating which risks they can afford to take. This isn't a sudden collapse. It's a slow bleed. One enrollment deadline at a time. One premium notice at a time. One family deciding that healthcare is now optional because the system made it unaffordable. By the time leaders admit the mistake, the exit doors may already be locked. And the people left outside won't be statistics anymore. They'll be the system's new baseline.